No matter how rarely you have met your doctor, no matter how little your doctor knows about you, the fact that you are on that doctor's list is a matter of some importance. Your doctor has contracted to provide you with the primary health care you need. Do you think that you're getting the best possible service out of your doctor?
And again. Stop. And breathe away.
When I come in to see him personally and sit down, he hasn't got the time to spend. Only if I want a prescription or something that won't take much of his time.
If it's the male doctor, yeah, kind of, because he's a man and you can talk about things, but when it's a female doctor, I feel like irritable, if you know what I mean.
When I go there, she's quite nice. You can have a good conversation with her. You tell her your problems, if you've got any.
9 times out of 10, I find that I'm not telling him the whole truth anyway. I just want to run out again.
You should use your doctor as you would use an accountant or a solicitor or perhaps even your bank manager. When you go and see them, you go with a specific group of questions that you want answered and topics that you want to raise. And I think it's helpful sometimes to know in advance what you want to talk about to your doctor and to make sure that when you leave his surgery, you've used his expertise perhaps, that you should make sure you've had an answer to the questions that you wanted to raise.
The most important aspect of the doctor-patient relationship is that both doctor and patient should feel comfortable in each other's presence. The patient should feel very comfortable in coming into his or her doctor, presenting all his or her problems, psychological, social, physical, and others. And the doctor should be sympathetic, listen carefully, and assimilate all the patient's problems. In that way, the doctor can build a picture of his patient. After all, the patient is the expert on how he or she feels, and the doctor is the expert on how to interpret those feelings.
Inner city health centre or old established group practice in a small town. Every practice is organised in an individual way. You'll find it helpful to understand the way your own doctor's practice is run.
This is Ashley, is it?
That's right.
What can I do for you this morning?
I've just moved to the area and I wish to see about going back onto the pill.
Yes, I see. Now, how long have you been off the pill? Well, this is a four-partner practice that has over the past 15 years evolved a partial appointment system. That is to say that each morning, while one doctor is visiting, 2 see patients by appointments only, and 4 see patients that have come to be seen on that particular morning.
What is the pill clinic? What does that involve?
It's a clinic which we hold for those people who are on the pill regularly, and you come along and see Sister and myself, and we give you a checkup and make sure that you've got no problems.
Is there a child clinic in the area anywhere?
Well, there are, but we have our own baby clinics at the practice, and those are held on 2 afternoons a week, and the health visitor will be here. Now, she will be contacting you, I'm sure, in the next few weeks, but she's here also with the nurse who does the injection clinic, and there's always 2 doctors present if you have got any particular problems.
You know, I'm a little bit worried that I've stopped breastfeeding and I'm worried about its weight.
Well, I think the best thing for you to do is to bring the baby into the clinic this week and have a word with the health visitor, and I'm sure she'll be able to advise you about that.
Oh, that's fine.
All right?
Yes, thank you very much.
So there's your prescription, and make an appointment to come to the pill clinic within the next few weeks, and we'll see you then. All right?
Right, thank you very much, Doctor. Thank you.
Bye-bye. I run family planning clinics, and we also have children's clinics. We find that this is better both from an organisational point of view and also psychologically from the patient's point of view. It's much better to have to give time to somebody with a gynecological problem in the afternoon than to try and fit it in during a busy morning surgery. Also, one of my partners has a minor operating session once a week under local anaesthetic, and this is a great help in avoiding long waiting lists for hospital. Likewise, our practice nurse has a Baruka clinic twice a month, which saves the children having to wait very many weeks to have to go to hospital to have them treated.
Hello, I'd like to make an appointment for this evening with Dr. Bayer, please.
Dr. Bayer's fully booked up, I'm afraid. How?
It is fairly important. It can't really wait till tomorrow.
You feel it's urgent?
Much of the everyday work of the practice is organised by the receptionist. She is not there to act as a barrier, but to help ensure that the doctor can attend to all of the patients most in need of his services.
He'll call you in as soon as he can see you.
Bye. Hold on a minute, please, and I'll just check the note.
The main role of the receptionist is making appointments for the patients to see doctors, taking the notes out of the file so that they're ready for the doctor, and filing them back, and just generally trying to keep the surgery running. The surgery is open from 8:30 to 6, and we usually deal with about 100 people in the day. It does vary though.
Yes, would you like to come Monday at 9 o'clock?
Generally it's not our duty to decide whether the patient needs to be seen or not. The doctor decides whether he wants to see the patient or not.
This woman has complained to her doctor about a pain in her knee.
Okay, fine. Come next door then. If you put a cold compress on your knee, as much as you can.
At this point, the doctor probably assumes that the consultation is over.
I'd like to see you again then, just to confirm that.
While I'm here, I'm a bit worried. My mum's been having trouble with her blood pressure, and I wonder if you could just check mine for me.
There is nothing wrong with the requests that the woman is making, but the doctor is now beginning to wonder how long he should have set aside for this consultation.
You'll just feel the cuff squeezing the top of your arm for a short moment, and then it'll gradually deflate. Right, well, I can't find anything wrong with your blood pressure. That seems fine. So I don't think you need to worry about that. Although it'd be worthwhile coming back every few years to have it checked if your mum's got high blood pressure. Okay, so I'll see you again in a week.
Yes, could I have a note for work, please?
Oh, yes, all right.
In fact, the woman's not making the best use of her time with the doctor, because she has not come properly prepared for the consultation, and has given her doctor no prior warning of the range of her reasons for coming to see him.
Husband's been having some trouble with his athlete's foot. Do you think I could have some more of the cream you gave him last time? That was very good.
What cream did he have? Do you remember?
Myco something. I don't quite remember. It was just some cream.
All right then. Well, I haven't got his notes with me now, so I'll give you some stuff that you can give to him, and that should do the trick. But if not, you better come and see me.
So the confused patient can cause some problems. But occasionally, with other patients, the doctor has to spend time delving beyond the initial complaints to discover the real underlying reasons for a visit.
I've had this terrible pain in my neck now for about a week. Just suddenly started off one morning and then gradually it got worse, and now it's with me the whole time. So it starts here and works down towards the shoulder, and seems to be getting worse.
And is it there all the time?
No, yes, it is.
If you get yourself worried or upset at work, does that make the pain worse?
Well, yes and no. Yeah, well, mostly yes. Things are a bit stressful at the moment.
Is there anything that's happened in the last week?
Yes, well, my friend's father died of a heart attack, but it's been quite stressful at the moment, and it's made me wonder if it's any connection, because my own mother died of a heart attack, and it's the same symptoms as what he had, same pain.
Did that frighten you?
It did a bit, yeah, very frightening.
Do you think that might have caused the pain in your neck?
Possibly. I mean, I don't know what the symptoms of a heart attack are. Just started here and it's sort of gone down the arm, and someone said that it's signs of a heart attack.
A major benefit of the family doctor service is that patients are able to talk to someone they know and trust. It is sensible to take advice when you're feeling ill. But there are other times when discussion may be just as important.
About having this little child vaccinated against the whooping cough.
Yes, I thought I probably wouldn't. I didn't have David done 3 years ago, you probably remember. There was a lot in the newspapers about it at the time, and I was worried about the risk of brain damage.
Yes, I think it made it difficult to decide then. But it's been shown quite conclusively since then that if you pick out children who are at risk carefully, i.e. exclude them from being vaccinated in the first place, the dangers are quite small, whereas the dangers of catching the disease are not small and can result in permanent brain damage or permanent lung damage, or even both if you're very unlucky.
And you really think that risk will be worse than the risk of having the vaccination?
I definitely feel strongly about it, yes, and would like to think that everybody who didn't have a good reason was vaccinated. Certainly I had my own child done.
Yes, knowing that makes a difference, actually. I would consider it, I think, for Rosie this time. I'd like to discuss it with my husband again.
Vaccination is just one example. But nowadays, it's your doctor's job to look more and more at preventative medicine, to start the treatment before you ever begin to feel ill.
So let me just look through your records. No, we've seen very little of you, haven't we?
No, I keep pretty fit, thank you.
5 years ago. You had a little trouble with your left ear at the time.
Yes.
Whilst you're here, what I'd like to do is check your blood pressure.
Is that really necessary, Doctor? I'm quite in a hurry.
Oh, it will only take a second. I mean, this is a routine measure that we're now introducing in the practice. We feel that everybody ought to have a blood pressure checked every time they come to the doctor. It's a very simple investigation, and really it will only take me 1 minute. I'll just put a cuff on your arm, and I'll record it quickly.
Okay, thank you very much.
Okay. Okay. Well, look, there's nothing to worry about. It's at the upper limit of the normal range. It's just beyond for your age group.
This patient may never develop really high blood pressure now that his doctor has been alerted in time.
But it's the sort of level that we'd like to keep an eye on.
Illness is as much the way we feel as the way we are, and emotional and psychological conditions form a large part of the doctor's workload. The stress of modern living ensures that many of us suffer from disorders, often with symptoms such as aches and pains, that originate in our own minds. The doctor may need to investigate our work, social and family environments in order to obtain a clear picture of the background to our illness. Only then will it be possible to decide rationally whether a medicine should be prescribed or whether the real answer is some form of counselling.
Fear and guilt are things that people always worry about, whether it's what's going on at home or at work or in their private lives and their relationships with other people. And it's something that I think people shouldn't feel embarrassed to come to their doctor about. Doctors are sworn not to give out details of any consultation to anybody else, and most doctors aren't very shockable. We've heard most of it all before, and that means that your doctor may well be the person who can advise you about a problem that seems so large to you, but that in reality may appear quite small to somebody else. And a lot of patients go away with their problems feeling very much less heavy on their shoulders than they were when they walked through the door.
Modern medicines are powerful, specific tools. They should be treated with the utmost respect. And this means that you should always make sure you understand how and when to take any that have been prescribed for you.
It's the doctor, dear.
Morning, Richard.
Good morning.
You go, dear. You go and sit down first. That's fine. How are you this morning?
Oh, not quite so good this morning.
In what way?
Got tummy trouble.
The old tummy trouble. Of course, as you remember, I told you last week, that really is because of all these tablets and medicines that you're taking. Are you still getting confused about it all?
Well, a little better now than I was. Anyway, they're getting better.
But you were confused, weren't you, last week?
Oh, yes, but didn't know.
Well, what I've done is to make out a list of all the tablets and medicines written down so you'll know exactly when to take them.
Oh, yes, lovely. Lovely.
So you have that.
Thank you.
Remember, the important one is this one here for your pain.
Yes.
So you must follow that very, very carefully.
Only to the certain line.
That's right. Are you getting any pain between the dosages?
Well, I had done this morning.
Well, if you do get pain between your dosages, you can take an extra 2 teaspoonfuls of the medicine.
It's not only the elderly who become confused about their medicines. If you are in any doubt about how they should be taken, ask your doctor to write out some instructions.
To see how you're getting on.
And David?
It's generally a mistake to discontinue a course of prescribed medicine without first consulting your doctor. There may be very good reason for completing the course, even if you're already feeling fully recovered from your illness.
And in fact he was feeling so well that I stopped the antibiotics.
How many days did you actually give the antibiotics?
He had them for 3 days, 3 full days.
All right. The only danger with stopping the antibiotic and not completing the course is that the bugs may become resistant to the antibiotic. And so what you're actually doing is killing off the weak bugs and leaving any stronger ones there in the chest. And David may get another chest infection. And if we give him another course of antibiotics, then we may not kill those strong bugs that are left. So that's why it's very important that you actually complete the course that's been prescribed.
Well, Mrs. Ordman, how are you getting on with your pill? I think you're at the end of the 2nd month now, aren't you?
That's right, quite well.
Whatever medicines you're taking, your doctor will want to be kept informed of any side effects that you have experienced. In many cases, these side effects will be only temporary or can be controlled.
So you're feeling all right apart from that and not worried? I think I warned you.
Yes, you mentioned it might happen, so I wasn't.
You weren't worried anything terrible was the matter?
No.
Well, I think you'll find that at the end of the 3rd and certainly the 4th month, all of those things will have completely settled down and gone. We could, of course, change your pill if they hadn't gone and you were still worried by any of them. But for the moment, I think I'd like you just to carry on as you are.
Hello, okay, thank you very much then. Bye-bye. Hello, can I help you? Excuse me, I've come for my usual prescription. I normally see Dr. Richmond and he gives me my prescription. I just come in and ask for it.
Prescribing medicines is a responsible task, so the doctor needs to be kept aware of your health and progress. You should not expect merely to collect repeat prescriptions without seeing your doctor at regular intervals.
If I just normally come and collect it. If I can give you an appointment, we can fit you in 10:15 the last thing this morning, or you can come any time you like. But you will have to see Dr. Richmond.
How can we summarize what is involved in getting the best out of your doctor? Together, you and your doctor are a kind of partnership. And it's the responsibility of this partnership to look after your health. The partnership can work well only if it's based on honesty, trust, and confidence. And remember, your doctor is the expert on medical advice and treatment, but you are the expert on how you feel.